With the Biden administration beating its own deadline to administer 200 million COVID vaccines, officials say supply is now outpacing demand. Meantime, a new CBS poll finds vaccine hesitancy in the U.S. is decreasing, but there are still people who refuse to get the shot or are still on the fence about whether to get inoculated. And some cite concerns about testing and potential side effects, as well as recent news about blood clots. So this all comes as Israel's health ministry is looking into a number of heart inflammation cases in people who received Pfizer's COVID-19 vaccine. Pfizer, meantime, says that it has not observed a higher rate of the condition than would normally be expected in the general population. So, Dr. Ron Elfenbein joins us now. He is the medical director and owner of First Call Medical Center. Thanks a lot for joining us again, Doctor. CBS News polling finds that nearly a quarter of people say that they will not get the vaccine, while another 18% say they might. How concerning is this to you? What does it mean when it comes to the nation's chances of reaching herd immunity? And I should point out, from what I understand about the numbers, is that we're talking about a core group of people that they haven't really fluctuated much since we started asking the question. Is there a concern that if there's a portion of the population that just never gets the vaccine, we may never reach herd immunity?
Yeah, well, good morning, Emery. We've been talking about this for a long time, and yes, it's concerning. Obviously, people are free to make their own decisions, but yes, it is obviously concerning. And I got to say that I think the federal government did not do itself any justice and help this cause at all with the recent pause with the Johnson & Johnson vaccine. With that vaccine, you're talking about a really, really, really minuscule risk, and yet they took it offline for 11 days, which only served to undermine people's faith in this whole campaign to get people vaccinated. And remember, it's not just the United States we're talking about, it's the entire world, because people look to the FDA and the CDC and say, well, what is the United States doing? So now you've undermined faith in this vaccine that really is probably the best of the three vaccines, if you want my personal opinion. And now you've basically undermined the faith people have in that vaccine. So I think that they did a tremendous disservice with that. So yes, it is a very concerning number, and you're right that it is a relatively stable group of people. But I bet in the next few weeks that number is going to change, because people look at the Johnson & Johnson and they say, wait a minute, there's all these things coming out. And as you pointed out, now there's questionable links to myocarditis, which is the inflammation in the heart that Israel is looking at, which there does not seem to be any direct correlation between the two. But, who knows? That's why we're waiting for the data. But I think that those things will only serve to further undermine people's faith in vaccines.
So, Dr. Elfenbein, the CDC is reporting that more than 5 million Americans have failed to receive their second round of COVID-19 shots. Explain why getting that second shot is so crucial. It certainly sounds, sometimes when a doctor says, hey, take some antibiotics, and even if you start to feel better, you gotta finish the bottle, right? I gave you 10 pills. I know you're probably gonna start to feel better after the fifth one, but you gotta follow through and take all 10. And I think we've been conditioned to be like, well, I feel great. Why do I need to take these pills, right? So can you just, again, confirm for our viewers that just getting the first shot is not enough? If it were, then that's all you'd be recommending for us to do with Moderna and Pfizer.
Correct. And think about it from a logistics standpoint. It would make everybody's job infinitely easier if they could just say, you don't really need that second dose. Don't worry about it. So, yes, you're absolutely, in order to get the full efficacy of the vaccine, you need to get 2 shots, and they have to be 21 or 28 days apart, or within, a week's time of that. So, yes, it is very, very important. And that is actually very concerning, Vlad. That I'm glad you brought this up. Roughly 8% of Americans thus far have missed the second dose. So what it does is, people, like you said, I feel fine, I feel great, I got my vaccine, I can go out in the public now, I don't have to wear a mask, I'm good to go, I'm vaccinated, but you're not. And I think it lends a false sense of security to people, and really all that does is even further undermine our efforts to get people vaccinated and to reach herd immunity, because people have this false sense of security, they're putting themselves out in the public, and they're really actually at heightened risk now because they're less safe and less secure, and they're going to be less diligent about, being safe and doing the things you need to do to keep yourself safe. So I think that yes, absolutely, 2 doses of Pfizer or Moderna and 21 or 28 days apart And that was one of the reasons why I said I think Johnson & Johnson is a superior vaccine, because you can vaccinate way more number of people much faster, because it's full vaccination, or full immunity rather, is determined by 2 weeks after your last dose of vaccine. So with Johnson & Johnson, it's a one and done shot. 2 weeks later, you're fully vaccinated. The other ones take, you got to wait 21 or 28 days apart, and then you got to wait another 2 weeks to be fully vaccinated. So yes, it is imperative that people get their second shot. Absolutely, 100%.
Doctor, obviously I'm not a scientist, and I know you're not an infectious diseases expert, so when I throw this question at you, but is this the sort of behavior, getting one shot and not getting the other one, is this the sort of behavior that can give rise to new variants, where you have people whose their body has been exposed to the virus, but not enough to protect them completely?
Yes, absolutely. And this is, again, why we talk about, as Vlad said, take the full dose of antibiotics if we give it to you. Because if you exert any sort of downward pressure on a microorganism, that microorganism, just from an evolutionary perspective, tries to get around your downward pressure. So the idea is you put as much downward pressure as fast as possible to eradicate that microorganism. So in this case, you're talking about vaccinations. It's the same concept. If you just get partially vaccinated, now you're giving that microorganism a chance to mutate and to develop new strains. And one of the ones that is very concerning now is this new one in India, the B1617 variant, which I don't know if I'm sure you're seeing what's going on in India, but the numbers are skyrocketing. And over the last few days, they've had over 300,000 cases, which is astronomical. And they're running out of oxygen, they're running out of beds. It's very, very concerning. Countries have shut down travel to India because of it. So yes, it is very concerning, and that is one of the ways that microorganisms sort of adapt.
That's the variant with the double mutation, not just a single mutation?
Yes, 2 mutations. Yes, that's right.
Yeah.
Dr. Elfenbein, of course, we were talking about the CDC lift of Johnson & Johnson's single dose vaccine. Earlier today, the White House senior advisor for the COVID response team, Andy Slavitt, joined CBS this morning, and he talked about what we've been talking about, vaccine hesitancy. He says that the Johnson & Johnson vaccine is an outstanding vaccine. I want to play a bit of what he had to say.
I think the first conclusion people should take away is our drug safety system is working great. That means that if there is even the slightest concern or the slightest issue, we'll know about it. The FDA will take action on it, they'll study it, and they'll come back and make the right recommendations. There's no way the FDA would recommend and that the CDC would allow this drug to be put in people's arms if people weren't very comfortable with it. So people just do their homework. Some people will prefer a single-dose vaccine. Johnson & Johnson's an outstanding vaccine. And some people will prefer not a single-dose vaccine, and you have Pfizer and Moderna. And we're really in a fortunate position where we have 3 highly effective vaccines, and people, I think, have some options. But no, I think a lot of people will continue to want to take the Johnson & Johnson vaccine.
So at this point, doctor, would you advise patients to get the vaccine, the J&J vaccine, if it's available to them? In other words, if they turn up at their local CVS or wherever they're offering vaccines and they say, this is the J&J vaccine, you'd say to that person, go ahead and get it.
I would tell my mother to go ahead and get it. Absolutely. I would have gotten it if it was offered to me, but I got the Pfizer vaccine was way, way, way back when it first came out. But yes, absolutely. But the problem he's absolutely right. It is a great vaccine, and what he's saying is true. But the problem is that now people look at this and they said, well, there was an 11-day pause. Now they're telling me it's safe. Before they were telling me it wasn't safe. I don't trust these people. I'm not going to get the vaccine. So I think that really just undermined the whole cause of getting people vaccinated, because people are going to look at this and say, well, I'm scared now. I don't trust these people. Had they not paused it and said we're investigating it, I think that probably would have been a better way to do it. But the 11-day pause certainly will give people concern to say, I don't really trust that vaccine. They said it wasn't safe. There was these blood clots, and now they're saying it's safe. I don't know. I think that undermines their credibility a little bit.
Really good advice as always. Dr. Ron Elfenbein, we thank you.
Thank you.